natin from last week. I'm gonna try and ask other people, what's the shapes of what shapes do viruses usually have? Anybody in the chat? Just some review questions. Don't worry. Okay, so I can see some people are ay Adrian. Ngayon ko lang nakita yung sagot ni Adrian. What are the shapes of viruses? Just for us to be icosahedral. All right, thank you, Adrian. What about other people in the chat? Helical. All right. So last week we talked about the icosahedral ones, specifically the ones that are listed in front of you. So there's six icosahedral ones that are of medical interest. Let's go back to them. Just a quick, just a quick discussion. Okay. All DNA viruses are, yeah. Okay, so we're already finished with that one. So we're going to continue with the icosahedral ones because these are the one because this again is important in your board exams. Okay. The icosahedral ones include what is our mnemonic? Our mnemonic is Pico, Flavius, and Rio went to a retro toga party to drink Kalisi shots. Okay. So those are those that's our that's our mnemonic so that we don't forget because we're gonna come back to them again and again during this lecture. All right. So the only RNA virus that has a double strand that is double stranded or that has a double strand in its genetic material. Of course, everybody knows it. It's the Rio virus. Okay, we've already discussed it last week. I'm just giving you guys a little bit of a warm up. Which of the family viruses are under the family Picornaviridae? Picorna, Picornaviridae. So there is only seven. There's actually five of them: rhinovirus, polio, hepatitis A, enterovirus, and Coxsackie A and B. Mind you, guys, they're all of them except for one is involved in in what? In ingestion. The mode of transmission of all five of them except for rhinovirus is ingestion. Rhinovirus is of course your common cold. All right. Why is it relevant to know if a virus is an mRNA virus? Because we want to know whether or not the virus replicates in the cytoplasm. And and that's important especially when one is designing drugs or rather vaccines for the virus. My voice is a little bit froggy. I'm terribly sorry, guys. Hopefully you can understand that it's morning here. But I'm trying to do my best be to be lively for you guys. All right? So it just takes me a little bit of time to warm up. So please be please be gentle with my voice. Okay? All right. So mRNA viruses are that's the answer to our question. Okay. So what are the families involved in the Calliciviridae family? We already know this again. Okay. This is the Norvalk virus and the hepatitis E virus. Please don't forget it because maybe um, this will be presented in your this will be asked in your board exam or any of your exams that might be coming up in the near future. Okay, so Norvalk virus and the hepatitis E virus. All right, what are the viruses? We're gonna move on with the viruses that are involved in the family Flaviviridae. If you're not, or Flavius is Latin for the color yellow, so it's easy for you guys to remember. This is the viruses under this family is the yellow fever virus, and then of course dengue virus. Now, easy way for you guys to remember it. Juan Flavier is one of our DOH uh, head of the DOH for a couple of years back in the 1990s. I don't know if you guys are alive back then, but Juan Flavier is the one who promulgated who designed a budget who proposed the budget for the dengue outbreaks, especially in the Philippines. during the months of the monsoon seasons in in our country. So just for you guys to remember, Flavi, Flavier, dengue. What else do I need to remember about Flavi? Yellow fever, of course, because the Latin term for flabby literally means yellow. All right? Understood? Okay. Now we're going to move on with toga viruses. Okay, so we have rubella and alpha virus, or the alpha virus group as it's commonly known now. All right. And what else do we have? Uh, what is um what is the most important clinical finding? I just wanted to ask you guys because probably this might be asked in the board exam if if you guys aren't sure if you guys aren't sure if you might not be informed about this, so I'll just throw it out there. What is the most important clinical finding for patients with dengue virus or infected with the dengue virus, or here in the Middle East they call it dengue virus? What's the most common laboratory findings, not clinical finding, the most common laboratory finding of a patient with dengue virus or dengue virus if you're here in the Middle East? Anybody? This could also be asked in the blood bank because this is one that requires a specific blood component. Anybody? Yes, wonderful. Platelet with what? What kind of what RBC inclusion? I'm sorry, Cherise, that's not the answer. Uh-huh. Low platelet, or what's the term? Yes. Yes. Thrombo what? Alyssa? Alyssa, I think this is your first time attending the lecture. And thank you. I know you were really. You're not just be okay, okay, okay. But that's okay. That's wonderful. Thrombocytopenia. That's wonderful, Alyssa. Thank you so much for answering that little review that might be asked in the blood bank, it might be asked in the hematology laboratory questions. So I just threw it out there. All right. Now let's move on to rubella. What is rubella? Common name for rubella, so we don't get confused with some of the names. Common name for rubella. Anybody in the chat? Don't worry. Questions. Don't worry. Rubella is mumps. Yes, wonderful German measles. All right. Actually, guys, what is the common finding for patients with rubella? Hmm? What's the most common clinical finding? I'm sorry, I'm talking about rubiola, sorry. Um, what is the common finding? Clinical finding. We're talking about clinical this time because this might be presented in a case presentation in your board exam. Mhm. Measles virus, measles virus, common. German measles is commonly what? Common findings. Anybody in the chat? Rubella, okay. And yeah. Mhm. Anybody in the chat? So it's usually a mild illness that has throat and rash, and it starts from the face and then it spreads throughout the whole body. Okay? So that's the answer to my question, guys. But thank you for trying your best to Google it for me. All right, so German measles. Another name for German measles, guys, or another name for German measles. It's common. You guys can just Google search it. It's fine with me. Don't worry. I'm not gonna I'm not gonna be pick. I'm not gonna try and force you guys to think of stuff that it's difficult to recall. But just for us to give, just for you guys to have a little bit of a recall. What's the other name for German measles aside from being caused by rubella? What do we need to remember? Another name for German measles. Wow. Well, now I have a question. Who was that? Who was that? I didn't see the name of that person. Who was that? Hello, who's that? Who's on the line, please? Oh, hi, Mayra. Mayra. Hi, Mayra. Now, where did you get the answer? Because I know it's a very quick Google search. I know. Yes, wonderful. We need to use the power of the internet. We were born in a generation that has the power of the internet, but you have to be careful, huh? But you have to be careful. Not all the data that has been presented to you guys in Google is credible. All right, now let's move on. Icosahedral RNA viruses that are mRNA, except for what? We only have three. Caliciviridae. We only have two, sorry. Caliciviridae and the family of Retroviridae. Now, I have a question again, just sort of like a review for you guys, or an advanced question for you guys. Um, Calicivirus, sorry, retroviruses. I need you guys to remember this. Retroviruses. What are the viruses that are under the family Retroviridae? There's two that is of that is of medical importance, especially for you guys, because this will be tested in serology all of the time whenever we're screening for blood donors. Okay, three, two, HIV. Okay, and another one, AIDS is caused by HIV. It's actually a syndrome caused by HIV. So that's the reason why we have HIV/AIDS. Anybody on the chat? Aside from HIV, what's the other one? There's only two that is of medical importance for us. It's usually tested in the serology laboratory whenever we're screening for donors. HTLV. All right. What's the meaning of HTLV? Alyssa, since you've been very um since you've been very active in this class. All right, wonderful. And was that from Google as well? Yes, wonderful. As long as you guys have ways to interact with me using the Google, I'm fine with it. Using the Google search bar, I'm fine with it. Don't worry about it. I'm not gonna judge you. Sir Marco will, but it's okay. But that's him. All right. Now we're gonna move on. Maybe I'm just kidding, sir. Don't worry. All right, what icosahedral RNA viruses are enveloped? Again, we're going to repeat the RNA icosahedral RNA viruses. There is six. What is our mnemonic? Flavio or Flavius, Rio, and Paiko went to a retro toga party to drink Kalisi shots. All right, so that's the reason why I want you guys to remember this, because some of the questions might come out like this. Which of the following is not an enveloped RNA virus? And I want you guys to remember that Flavivirus, Togavirus, and the retroviruses are naked or envelope rather. Okay, so what do you mean by an envelope virus, by the way, guys? It has a lipid membrane. Okay, it has a lipid. The viral particle has some sort of cover. Okay, just so it can survive longer outside the body fluids. Not necessarily longer, I mean days, but rather hours. So it becomes a problem, especially when it's in the body fluids. So what are the viruses that we're talking about? Icosahedral virus. My mnemonic here would be fart. Why fart? FRT. Fart. Flavivirus, retrovirus, and the Toga virus. Fart. Okay, I don't know if it's important. I don't know if you will remember it, but hopefully you guys will, because this is a question that was actually asked in my board exam. It's actually one of the two questions that was asked that was asked in the topic of virology. So please don't forget this, okay? Because it may or may not be asked in your board exam, but as long as you're familiar with it, that's fine with me. Now, naked RNA virus, on the other hand, my shortcut is PCR. What do I mean by PCR? Picornavirus, calicivirus, and the reoviruses. Okay, so those are your envelope viruses. Now, let's move on to the helical RNA viruses. Now, the helical RNA viruses is actually 8 viruses that we need to remember. And one of them is the naked one, the naked RNA virus. I think you guys can guess which one is the naked one. It's very common right now. We're actually suffering from the effects of this particular viral family. And what is the answer? I'm looking for it in the chat box. So I want you guys to give me one helical RNA virus that is naked. That is the only one that is naked. I'll give you guys a clue. The clue is we're suffering the effects of this particular viral pandemic because of this viral family. Corona what? I don't like incomplete answers. Corona what? Coronavirus. I love it. Who was that? I'm sorry, I was searching for something. I was looking at a message rather. Coronavirus. Who was that? I didn't know who. I didn't know the voice. I didn't recognize the voice. Alyssa, was that you? Okay, thank you for being participative and completing your virus. Somebody spelled it wrong. It's not coronavirus. No, no, it's okay. The spelling is correct. Mayra, I was being I was trying to scrutinize Mayra's spelling. I'm sorry. She actually spelled it correctly. But although I would have appreciated it if you added a capital letter, but that's fine with me. All right, now we're going to talk about the helical RNA viruses. We already know one. We just need to name the seven. All right. The other ones will be posted. Why is my lecture is not moving on the wait. These are the ones. Now do I have a remote mnemonic for you guys? Of course. I love you guys so much. I'm providing you guys with a mnemonic because this is important. Hang on a sec. Let me pull out my mnemonic. Mnemonic. Where's my I need to search for it. Mnemonic. I'm searching for my mnemonic. Hmm. Ah yeah, this one. This one. I would like to share it to the group, but hmm. Hmm, 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 hmm. It's not sharing. I wanted to share it. Ah, this one. I'll just put it on the chat box for you guys. The mnemonic is here. Okay, wait. I'll just share it in the chat so you guys don't so you guys have some sort of I saw it somewhere. It was a very cute drawing and I wanted to show it to you guys, but unfortunately it's not showing up in I don't know why it's not showing up. So this is our mnemonic. Bunnies mixed with rabies are thought to fight in the Delta Arena. I have a drawing of that one, but it's a so bunya that are mixed, so para mixo, okay, and then with rabies, rabdi, okay, are thought of are thought of sounds like ortho to fight philo, okay, delta arena. Okay, arena. But why delta? Why did I add delta? Delta viruses includes your Lassa virus. Okay, so I hope you guys can remember that one. I'm gonna share a drawing with you guys later so you guys don't forget about it. But and they are all inside just to win the crown. I forgot to I mention just to win a crown, Corona. Okay, so I hope that was a little bit easier for you guys to digest because there's tons more. There's a ton of material that you need to remember. So hopefully this is something that you would remember. Okay. Now, which helical RNA virus has a bullet-shaped virion? It's important for you guys to remember these shapes also, not the structure, not the helical RNA virus. The general shape is helical, but when you look at it in the electron microscope, it looks like a bullet. The viral particle or the virion, that is Rhabdoviridae, the family Rhabdoviridae. And actually, what virus is prominent in the family Rhabdoviridae? Anybody can answer in the chat? Anybody? What virus is under the family Rhabdoviridae? What virus is prominent in the family Rhabdoviridae? You can use the Google search bar again. It doesn't. Rabies virus. Very good. And where do we send people with rabies virus? There in the Philippines. They might ask you that in the board exam. Where do we send the people who got bit? San Lazaro Hospital. Why? What's the importance of San Lazaro Hospital? Infectious diseases. It's the only one in our country that can give massive doses of what? Anti-rabies vaccine, of the anti-rabies vaccine in the country. Okay? We send people there, uh, especially those who are on the later stages of rabies. And I wanted to share a picture, but again, I can't share it because I'll share it to you guys later on. Rabies virus. It's actually not the only place that can have anti-rabies, but the facilities there are 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 ideal for preserving the shelf life of the vaccines. That's why DOH, because DOH is also located nearby, they put it there. They would much rather put it in one place and allow the people to go in for their shots. Okay, so just a little bit of information for you guys. So yeah, now shall we move on? Bullet shape. This was actually asked. Funnily enough, this was actually a question that was asked in one of my students who participated in the PAMET quiz show. If you're not familiar with the PAMET quiz show, it's actually one of the, I would say, the Olympics of medical technology knowledge there in the Philippines, and it's quite an honor if you were invited by if you would represent your class in 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 a specific year. So hopefully one of these days I would hear someone from Capital Medical who would have won. That would be such an amazing opportunity. That would be such an amazing thing to hear if I hear someone from Capital Medical and they say somebody won. Okay. And again, it would be extremely, and I would be extremely happy if one of them were my students. All right. So, which RNA virus have segments? Actually, there's three of them, and all three of them can be differentiated based on the segments: orthomyxo, arenaviruses, and bunya viruses. But let's talk about the segments. Why is it important to talk about the segments? I actually don't know. I just posted it there because it is a question that is always provided by a lot of people in the review centers, and I thought I would just put it in the mix bag. So since you guys are remembering um a lot of a lot of information right now, just for you guys to remember. Um, they did ask about orthomixo a couple of months ago, a couple of not months, a couple of years ago in one of the board exams. But I'm not sure how it was actually presented. Orthomixo might be a recall question, it might not be a recall question. I provided it for you guys just so you guys are familiar with it. So orthomixo has the most segments. Arenaviruses and Bunya viruses are also segmented. But the only difference is that arenavirus has two segments and the Bunya virus family has three. Okay, so if we're talking about recall questions, I would say the most important one that would be in the board exam question bank would be orthomixo because it's the one that has the most segments. It might be asked in the board exam, it might not be, but at least I provided it for you guys. All right. Now, which viruses are infected which viruses causes infected cells to clump and form a syncytia? Paramyxoviruses. In fact, we have what you call RSV. Does anybody know what RSV mean? It causes viral. Yeah, thank you. Now I recognize your voice, Alyssa. Thank you for being participative today. Respiratory syncytial virus. Yes, that is correct. That is correct, ma'am. That is correct in all levels and work, girl. Thank you so much. All right. Oops. Uh-huh. I'm gonna put my picture. I'm gonna put my video stream on this lecture. Okay. Uh-huh. I don't know why it's not showing up, but anyway, let's move on. Um, what are the viruses under the paramyxovirus family? So we have the viruses. One of them is RSV. So you guys just need to remember three more. Para-influenza, okay? Measles virus and the mumps virus, okay? Para-influenza, measles and mumps, and of course RSV. Okay, so these are the viruses that are under the Paramyxoviridae family. All right, and all of them can form syncytia. What's a syncytia? Well, it's actually seen in a histological cross section of the lung, especially for patients who have especially who have or patients who are suffering from viral pneumonia, and they sort of form like the appearance of it in the X-ray would be similar to that of a I'm not really clear on the radiographic terminology, but it seems to appear. It appears like a uh, what you would expect from someone who has lung cancer or tuberculosis. And these patients are usually the ones who are terminally ill, and they want to be treated, and we can treat it. They want to know what caused it, and then when they do a lung biopsy, they would see syncytia or clumps of infected cells. What does an infected viral? What does an infect? These are basically viral inclusions in the normal cytology of the cells, and syncytia is pretty common in these particular viruses. Now, they're not exclusive for the paramyxoviruses, but they're extremely common in RSV specifically. Okay, so if you guys remember, if you guys see the term syncytia or clumps of virally infected cells, please don't forget about the family Paramyxoviridae. All right, helical RNA viruses have a circular genome structure. Which one of those has a circular genome? Well, these are the Bunya viruses or the bunnies. Okay, the Bunya viruses. Now that's the last question or the last flashcard regarding the differences between RNA viruses, DNA viruses, whether it's enveloped or naked. Those are the things that you guys need to remember, especially when it comes to virology. I don't know what's wrong with our examiners there in the Philippines, why they like to categorize a lot of these viruses. not actually ideal in terms of it's not actually ideal in terms of the practice because uh, I guess they just want to put virology questions, but for the sake of you guys learning about virology, for the sake of you guys passing or at least answering some of the questions in virology, I posted some of the things that you might encounter with regards to general virology. Now we're gonna move on with viral replication. Okay, what are the steps of viral replication? Of course, a virus needs to be adsorbed, or okay, or it needs to first make contact. How does a virus make contact? I'm gonna ask again in the chat. Anybody, anybody can, anybody can unmute themselves. But I think a lot of people are knowledgeable right now, especially you guys because you're medical technology students. But try to humor me. What is or how do viruses adsorb in the adsorb as, or becomes adsorbed in a cell, in a particular cell? So let's talk about, for example, HIV or coronaviruses. How do they get absorbed in the? A quick discussion. Anybody in the chat? How do viruses get absorbed in the cell? Anybody? They require what? Serology, guys. It's a serology review, actually. Anybody? Adrian. Yes, Charisse. Oh my gosh, Charisse. Thank you for participating. Charisse, yes, correct. Charisse. Oh my gosh, Charisse. I'm I'm shocked, Charisse. I haven't heard your voice, but you're usually just in the chat room. And but for that answer, thank you very much. Receptors, guys, receptors. Um, H I um HIV binds to T cells, help specifically the helper T cells because of the CD4. All right. Um, what else? Herpes simplex binds to a specific one. I can't remember right now at the top of my head, but I'll remember it later on. Okay. Herpes simplex also has a specific receptor. That's how they become. That's actually their way of hijacking a cell. They would rely on the cell surface because they have what you call the opposite cell surface. They have a surface molecule as well that would be complementary to that one, and it would allow the cell to absorb it, or rather, it allows it to become penetrate. It allows the cell to penetrate through the cytoplasm and do whatever it is it will do to replicate itself within the host cell. All right. Now, the cell would then be uncoated if it's enveloped, but if it's naked, it will just break. The lysosomal enzymes will break up the viral cap, the viral structure, the virion, and it will release its genetic contents to the to the cytoplasm of a cell, and then afterwards it becomes part of the viral genome either through splicing or to integration using the enzyme integrase if we're talking about viruses that has integrase within their viral capsid. And then the last stage of viral replication is of course manufacturing, or what we call release of virions. Okay? So how do they do it? How do they get viral copies of themselves in the form of virions? Again, they will hijack the genetic material of a particular cell or the target cells, and then they would then become part of the DNA structure in terms of the retroviruses, or in terms of RNA viruses. They combine themselves to the or they integrate themselves RNA of mRNA, or specifically the messenger mRNA, and then they would be copied by by a transcriptor codon. This codon will then send out messages to the rough endoplasmic reticulum, and they would produce copies of themselves, or they would assemble themselves based on the genetic code provided by of course, their own genome. So these viral particles replicate in such a way. But I've I've summarized the whole process for you guys in this particular slide. Okay, adsorption and penetration, viral viral cell surface markers is important for that one. Uncoating of the virus, which means it exposes the genetic material. Synthesis and assembly of viral products. That's usually going to happen in the cytoplasm, or even in the yeah, it usually happens in the cytoplasm, especially in the transcription phase of protein synthesis. And then viral particles, or virions, will be released into the cytoplasm, causing the cell to burst out, or they will be packaged by the host cell itself. See how wonderful viruses are. I think a great way to understand disease progression is by studying viruses, because they have such an elegant way of um, producing a disease, of initiating the disease process. It starts with something as innocuous as like one particle entering an unknowing cell, and then and that one particle would then hijack one cell, and then it will create copies of itself within that cell, causing that cell to explode, and then infecting nearby target cells. So see how wonderful viruses are. I mean, in terms of in a biological, or rather in a medical perspective, but in a pandemic perspective, I don't think it's fun. Especially right now, we're all here stuck in our rooms, and you guys are studying online. But yeah, that's how elegant viruses are. Now let's move on to the next one. Um, what brings about adsorption and penetration of the virions, or the virions? Again, it's glycoprotein, or what we call the spikes. I forgot to mention spikes. Okay, glycoprotein receptors. All right, internalization of a virus in the host is done by what processes? Actually, it's either endocytosis. If it's recognized by a cell to be acceptable, it will then be endocytosed. Okay, and then it will fuse with the cell wall, or rather the cellular membrane of of the the host cell, and then it will be inserted into the cytoplasm. And then afterwards, uncoating happens because of the cytoplasmic molecules. All right. So endocytosis. This is endocytosis. Some viruses do this. All right. Some viruses do fusion. How does fusion differ from endocytosis? Well, basically, the viral particle is naked in this term. When we talk about endocytosis, we're talking about viruses that are naked. A naked virus will be recognized by a cellular receptor, or your glycoprotein spike. That glycoprotein spike would then, oh, okay, I recognize this one. I would accept it. In terms of fusion, the cellular receptors, or the glycoprotein receptors, are located in the envelope of the cell, of the viral particle. The viral particle, the viral particle's envelope has cellular receptors that are recognized by the host cell's cellular receptors, and then it would recognize it as its own, and then it will fuse with it. The envelope will then be removed, and then allows the entry of the virus. Okay, so that is the basics of fusion, or endocytosis. Just keep in mind that endocytosis occurs when the virus has a naked viral structure, and fusion occurs when the virus has an envelope structure. All right. Now, what's the difference between positive stranded and negative RNA virus in terms of viral replication? Again, this was a question that was asked a couple of slides ago, I think last week. I'm just gonna try and give you guys a bit of a summary. Positive ones, the replication is immediate because the virus is directly read by the messenger RNA. A negative one needs its needs an RNA polymerase before being read by the mRNA. So that's the difference between them. Immediate positive, and then the one that requires polymerase or mRNA polymerase to integrate itself into the host cells RNA before being read by the mRNA. All right, so that's the basics of positive and negative stranded. Okay, now let's move on to viral penetration. So after viral penetration, how can the genome of a DNA virus, now we're talking about the DNA virus, hijack the host cell? Well, the viral genome will then be spliced to the host's genes. What do I mean by spliced? Well, I would want to talk about how the retroviruses do their hijacking capabilities. HIV is a great example of how genes are spliced inside our host cells, or specifically our T cells. What happens is, I'm not going to talk about the specifics. I'm just going to talk about it in a broader sense, so you guys can digest it. Because it will take us a couple of minutes if I were to jot down everything about the RNA virus, the retrovirus, or specifically retroviridae splicing of the genes. So what happens is, as the virus enters the cell, it goes to the cytoplasm, and then it will have its reverse transcriptase within its viral capsid. The reverse transcriptase is responsible for turning the RNA to DNA. Now, what's the importance of that one? Because we have what you call integrase. Um, it will be the viral particles, genetic material will be sent to the host's nucleus. Why is it important? In that particular event, the host's nucleus is normally has the genes for the production of its structural proteins. All right, but once the virus enters, or once the viral genetic material enters the cytoplasm and hijacks itself by splicing it together, that's the time the viral genes will be read as DNA by our transport RNA, or the tRNA, and then they would go out, and they would be then and then these coded materials will then be transcribed into proteins. So the central dogma, that's what happens. Splicing means mixing of, I would say mixing, but rather replacing a certain segment of the host's gene with the viral genome. Okay, because these are just short viral genome genetic material is extremely small as compared to its target host cell. All right, so I hope you guys understand the basics of splicing. All right, so two phases of DNA virus replication. There's two phases: early transcription and late transcription. All right, so early transcription is important because it results in the translation of proteins for DNA replication of the virus. Late transcription is important as it results to translation of structural proteins for viral assembly. Okay, so early transcription is responsible for translation of genetic material for protein production. Okay, so anything that's both DNA and RNA, that's for the early transcription phase. The late transcription phase is actually now the translation of the genetic material to form the structural proteins of the virus. All right, so that's the two phases of DNA virus replication. Now, differentiation of how do we differentiate the release mechanism and the release mechanism of naked and envelope virions? Naked virions undergo exocytosis. Envelope virions are released from the host cell by budding. Okay, and what is much more dangerous for the cell. What causes the cell to die much faster? Exocytosis. Before we discuss it, basically the answer to this question is almost always similar to this one. Okay, so which do you think is much more dangerous for the cell? Budding or clothing or exocytosis? Anybody? Um, Guesses would be appreciated in the chat box. Anybody? Which one is more destructive to the cell? Exocytosis or budding? So we're talking about the viral particles or the virions exiting the cell. Which one is much more dangerous to the host cells? Any guesses, guys? Anybody in the chat? Regine, Alyssa, what are your guesses? Yeah, budding or exocytosis. What's your choice? Which one is much more dangerous for the cell, or it kills the cell much faster? Adrian, what about who else is in the chat? Because yeah, which one do you think? I guess would be fine with me. Which one is much more dangerous for the cell? Exocytosis or much deadlier to the cell? Exocytosis or budding? Yes, correct. Thank you for that wonderful answer. Why is it dangerous? Because budding takes part of the cell membrane. It takes a part of the cell membrane, which means although the cell doesn't die off easily, the more viral particles exits, the more the cell the cell membrane decreases. See the difference between them? Look, I'll show you again the drawing. See, it takes a part. Imagine this as a reverse. Try to imagine it as a reverse process. The cell is outside. It will go out. In exocytosis, it will go out upward. Imagine it upwards. In exocytosis, what happens is it takes a part of the in budding. We're going to refer to the right picture. It will take a part of the cell membrane. Okay. In endocytosis, in exocytosis, it requires a lot of copies for the cell to explode. Okay, so the cell needs to explode first, or it has to have enough sufficient copies of itself before exploding and releasing its viral particles. In endocytosis, in budding rather, in budding, the cell's structure is being depleted faster because the more viral particles are being created, the more of the cellular component is the more the cellular component becomes diminished, and that's how the cell dies. And it's much more dangerous for the cell if the virus keeps on budding. Okay, now let's talk about viral infection. What are the possible outcomes of viral infection, or the possible end results of viral infection? Of course, it will cause cellular death. That's what we're talking about this particular the previous slide. Of course, cell death is the event. Cell death is what happens in this particular case. But there is another possibility that a cell might transform the host cell, and actually, this is through the result of activating oncogenes. Remember that some viruses integrate themselves in the genetic material of a specific host cells, and certain combinations that happens through the splicing of genetic materials can sometimes activate oncogenes without can activate oncogenes without the need for external risk factors, like would say hepatitis. I would say, let's talk about hepatitis B virus. The latter effects of this infection can cause can cause hepatitis B. Huh? I'm talking about hepatitis B, which is under the Hepatnaviridae. Okay, so in the later stages of the viral infection, especially in the chronic phase, what happens is because there's so much viral splicing, there's so much viral splicing that occurs in the DNA, and the body can't clear the virus from the body, and the body can't clear the virus out of the body by traditional or rather generic immune response. What happens is what happens is the constant splicing actually causes the cell to be transformed, and certain oncogenes that aren't present or that aren't a risk factor for a particular patient becomes becomes evident, and that is why it's dangerous to have chronic infection or chronic viral infections, especially for some viral infections. Kaposi sarcoma form of is another form of cancer or viral cellular transformation that is caused by a virus or that is initiated by a virus. Kaposi sarcoma is caused by what what virus? Anybody in the chat? Kaposi sarcoma. Anybody in the chat? Anybody? Hello? AIDS patient. What virus infects an AIDS patient? What virus has infected an AIDS patient? Rather, what do you mean HIV, right? Kaposi sarcoma is Kaposi sarcoma is actually one of the effects of a chronically ill HIV patient who has undergone AIDS or has developed into AIDS. So the CD4 is incapable of um, the CD4 cells aren't able to clear the cell from the body, and the oncogenes are being activated. So those are the things that happens in. So basically, that's what happens in, or that's the main thing that you need to remember in terms of viral infection. There are two events that can happen, or there are two possible end results. One of them would be cellular death, and the other is activation of oncogenes, or what we call cellular transformation or cell transformations. Now, this is a form of a viral infection with no clinical manifestation in which the virus survives in a sleeping or inactive state, but can be reactivated by several factors. Now, that is what you call a latent infection, or what you call a latent infection if you want to sound posh, latent infection, okay? And this type of latent infection, which can cause a disease for years after the initial inoculation. This is the type of this is the type of sorry, this is the type of infection within which the virus can cause a disease after the initial inoculation stage. Chronic or slow infections. Why is this important? Why did I put it here? Because it might be asked in serology. What is a latent infection? A latent infection, if you, again you want to sound posh. A latent infection is when the viral infection shows no clinical manifestation, and the virus survives in a sleeping or an inactive state. Okay. A chronic infection is different because the disease process takes such a long time, or it takes the disease years before the inoculation, after the initial inoculation stage. And what is an example of a chronic or a slow infection? Let's talk about first latent infection. What viruses can cause latent infections? A cell goes into the sleeping stage, and then after some time it becomes reactivated. Anybody in the chat? Anybody? Anybody? Can you give me an example of a latent viral infection? Pretty common, especially it's causative um, kissing disease is a common latent infection. Herpes simplex virus and shingles. Wonderful, Joanna. Thank you for attending. Thank you for attending our lecture today. Thank you so much. That is shingles. That's correct. Shingles. What causes shingles? What causes shingles? Chicken pox, right? A herpes virus, and shingles. Shingles is actually the latent version of chicken pox. If you're not, if we're not, if you want to be more specific. All right. What about for chronic infection? Give me a disease that takes a very long time, to develop, or that takes a very that's common in that is a common slow infection. Takes years for your infection to. It takes years for the disease to manifest itself. AIDS is an important. Again, yes, AIDS. Okay, another one aside from AIDS. We're always talking about AIDS. I don't know why. But yeah, what else? Varicella zoster. Yes. Yes. Wonderful, wonderful. But actually, Mayra, varicella zoster is actually a mixture of both. Varicella could be a chronic infection, and it could be a latent infection. Some cases, varicella would just stay in the body, and then it becomes reactivated once the patient becomes immunocompromised. In other cases, varicella will would infect the body. The patient is already immunocompromised, but is capable of fighting off the disease because of certain therapeutic drugs. Um, Certain therapeutic drugs. The disease process takes a very long time. Um, Cold sores would appear all over the body, specifically in the oral cavity, and then it becomes zoster syndrome. Uh, it takes a couple of years actually. Untreated sometimes. Usually, it affects people in the United States who are homeless. A lot of patients, a lot of patients in the United States who are homeless suffer from the effects of chronic to late infection. Why? Because they can't seek out treatment, primarily because of their economic status, and so the disease process takes a very long time, and untreated it becomes untreated, the virus replicates itself and becomes a chronic virus. So it's a very difficult subject to talk about, primarily because it's a mixture of both. But yeah, your answer is somewhat correct, partially correct. I would give it a partial correct uh, check checkbox. Now, let's move on to specific viruses. Now, before we continue with the specific viruses, I would like to give people a 5-minute break so that they can gather their thoughts. Remember, 10-minute break would be enough. Is that okay? Um, Alipores ni Sir ni Sir Marco. Okay sa mga alipores na si Adrian. Okay, wonderful. I haven't seen the other ones before yet. By the way, guys, the contest will begin later at the end of the lecture if you want to participate, okay? I'll tell the mechanics after the break. I'll tell you guys the mechanics because I'm still typing the mechanics. All right? I'll see you guys after 10 minutes. Um I won't leave the chat room, don't worry. Um I'll just be here.